سعيدا كن فريدا عش بفخر في الحياة لا تبالي فالمعالي بالتحدي لا سواه كن سعيدا كن فريدا عش بفخر في الحياة لا تبالي فالمعالي بالتحدي لا سواه.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to Ilm TV. The program is going to go through is health and lifestyle. My name is Dr. Hussein. I work with the MP Shah Hospital as a pediatrician. So this series is going to focus on child problems primarily. So I'll take it step by step with different sessions tailored completely towards children. The first set of, in this I'd like to go through is questions parents ask us all the time about what to look for when a child is born and as they're growing, what stages of life they go through, and what are the key things they must look out for to notice that a child is actually growing normally and keeping up with what we call the milestones which we expect a child to achieve at different stages of their life. I'll just start off with a child who's just newborn. So I'm not talking about a preterm baby, but a child who's born at the expected date of delivery and who's then growing step by step. So the first thing we look at when a child is born, you'll notice that the moment the child is born, we pick the child and we quickly examine from the head to the toe. Some of the things we look out for is, does the child have a normal shape of the head? If the shape is normal, then we're a little bit okay with it. There are times when, yes, one side might be a bit flat, there might be a bit of swelling on the top of the head when the child is born just because of the process of delivery. But that's one thing we actually look out for. Then we check whether the child has normal hands, normal legs, when we are able to see all the body parts in terms of the ribs, we can see all that. That must be looked out for. The other thing we listen to very carefully is the heart. We must make sure the heart has normal heart sounds. And you might notice that sometimes we pick a child and we run and start oxygen quite early. Please do not get worried when that happens to your child. The reason being, either the person examining this child has noticed that your child is turning a bit blue, or your child is not breathing as well as they should. So if that happens, do not be worried. The person who's done that will come and explain to you why they took your child away. The other thing we look at is the mouth normal? There's some children who are born with a gap in the top part of the mouth, the palate. That's what is looked out for as well. The other thing we look out for is, does the child have normal genitalia region, or is there an abnormality? Some of the other things we check quickly are things like, most parents have heard of Down syndrome. So we look out for whether there are any features of Down syndrome in a child. That's quickly monitored the moment a child is born. The next step that usually has to happen is, if the child is okay, we will almost always give the child back to the mother to keep the child with the mother, because the mother's warmth is more important for the child at that point in time compared to us wrapping the child in blankets, putting them in those incubators. That is all artificial heating. We'd rather prefer that the baby stays with the mother, and if possible, within half an hour to 1 hour after delivery, that newborn baby should start breastfeeding, since breastfeeding is what's actually going to make that child settle down and remain stable from throughout, and not have problems with low blood sugar, getting weak, getting sleepy. That's the reason why we give the child back as quickly as we can to the mother. As the child grows, there are other things we monitor. So you'll usually be told when you're being sent home on the second, third day after your child is born, to come and after 2 weeks and get your child checked again. Usually at the 2-week check, we're looking at, one, has your child gained any weight? So if, say for example, a child is born weighing 3 kilos, we would like to know that your child has gained approximately about another, say 15 to 20 grams per day after they're born, and that's something we keep an eye out for. So the moment your child comes, we will weigh your child. The other thing we look at is, how well is your child sucking on breast milk? So if they're sucking for breast milk very well, that's a good sign. If your child is now looking yellow, what we would call the jaundice, yes, that's now of concern to us. Because has your child become very yellow, and is that yellowness showing head to toe? That's when we will probably tell you that we need to check the levels of that, what we call the jaundice, and we'll do a blood test at that point to determine whether those levels are very high. As far as the levels go, you'll be guided depending on the levels your child has, whether your child was born preterm or whether your child was born on time. Those are some of the things we'll actually follow up step by step as you come for the second week visit. The other thing we like to monitor for the second week visit is, does the mother have enough breast milk if she's breastfeeding for her child? That's best noted by how well the child has gained weight. The other thing we always do is, you'll notice us checking the circumference of the head of the child. The reason being, we expect a child's head to grow the moment a child is born. If the growth is abnormal and it's grown too fast, we'll keep an eye on your child. So we'll tell you that no, this head circumference has grown too fast. We need to determine whether there's any fluid collecting inside the head. So those are some of the things we have to monitor at the 2 weeks check. Then you'll be told the next time your child needs to visit is approximately at 6 weeks of age. At 6 weeks of age, again, the weight is important. The length of your child is taken again. And there's a chart you'll always get, the booklet which comes with your vaccinations. On that booklet, there's a page where there'll be a graph for the boy child, there'll be a graph for the girl child. Each of those is monitored and plotted on that graph, and we try to see how well is your child following the graph. If your child is dropping weight or dropping length on that graph, well, usually it's the weight, the length might be the same. We keep an eye out and tell you, okay, maybe your child is not feeding as well, or your child is not growing and something else is wrong. That's something we'll actually watch out for. At 6 weeks, we also expect a child to get the first set of vaccinations, which you'll be given. I'll discuss that in another session on each of the vaccinations that need to be covered, and we'll go through each of those step by step. The next time you'll be told to visit is approximately at 2 months of age, when your child turns 2 months of age. The reason being, at 2 months of age, we expect a child to do two things. One is, if we lift your child with their hands, we expect them to keep the neck and lift the neck up together with the hands as we lift your child. This, you can even test yourself at home when your child is approaching 2 months of age. Can I lift my child up with the hands, and will my child bring the neck up with them? It might fall back a little bit, but they're expected to bring it up together with the body. If you don't see that happening to your child, you can actually come a little bit earlier and come back to the hospital where your child was born and tell the person you find that, please, my child is not doing this. Is there something I need to worry about? At that same point in time, the child should be breastfeeding well. We will again take the circumference of the head and monitor how fast the head is growing and how much fluid, if there is inside the brain, how much it is going on. That's something that will be monitored. The next time you'll be coming to visit is when your child turns 10 weeks. That's primarily for vaccination. So at 2.5 months, you'll come back for the second set of vaccinations. And then again, you'll come back at 14 weeks, at 3.5 months, for the third set of vaccinations. And during each visit, we'll take the length of your child, the weight of your child, and if there's anything abnormal, usually you'll be asked to see whichever doctor you can find, and you'll be advised accordingly on what to do. After that, what happens next is your child comes at 6 months of age. 6 months of age, now we examine from the head down to the toes again. The two key things that your child must be doing at 6 months of age. One of them is, your child should now start sitting and be able to sit on their own for a few seconds. So if we lift a child up and put them to sit, they might rock a little bit and after a few seconds fall down. But they should be able to sit for a few seconds on their own without the chair supporting the back. They should be sitting on their own. The other thing your child should now start doing at that point in time is, when you make sounds, they will try and copy the sound that you make. And when you give them something to hold, they will start holding it with their hand and bringing it towards their mouth. If they do that, that means your child is now growing both physically as well as the brain. So mentally, your child is growing as well. So it's a step-by-step process that is happening to your child, and they're getting stronger and stronger day by day. The other thing they will do is, if you make a sound and you give them something, they will turn towards the sound, try and hold and grab whatever it is where the sound came from. So it's a step-by-step process they will actually follow as they grow. The next time you come for your vaccination is 9 months of age, depending on which set of vaccinations you take. At 9 months of age, again now around this point in time, children will do two things. They will either start to already crawl, or some children will hold themselves with their hands and lift themselves up and stand. So some may not crawl, they will try and walk straight away instead of crawling, which is very okay. When they start to do that, that's a sign that now the muscles are getting stronger, the bones are getting stronger and actually growing. So it's a step-by-step process from birth, 2 weeks, 6 months, and now finally at 9 months. At about 9 months, what they start doing now is when you make a sound, they almost get that sound correctly. So if, for example, you tell them, say mama, they might actually say ma, and they will try and copy you. So there's certain sounds which they will start to make and almost mimic you exactly as you speak the words that you want them to obey. It's usually just one or like a word that is like mama, baba, they will try and copy you. And they'll also start now rocking, making their own sounds. They'll start laughing at things and they will start doing all that. We also expect them now to hold things, trying to hold them with 2 fingers instead of the full hand. They will try and do that and improve their grip. So when you give them something to hold, it becomes very hard to take it away from them because they will hold it tight. And they will actually cry if you try and pull things away from them now. That's about the time where they're also getting very attached to specific parents or specific people. So when you pull them away from the caregivers, they're less likely to want to go away and cry a lot more, which is usually expected at that point in time. The other question people ask is, when should my child have teeth? Teeth can start coming out anytime between the age of 4 months till about the time your child turns 1.5 years old until 18 months of age. So do not be worried if one child got teeth at 6 months. One child gets teeth at 1 year, 2 months. Please do not be worried. Each of your children will get teeth at a different point in time. And more often than not, the teeth that will come out first are either the 2 top front teeth or the 2 top lower teeth. Those are usually the teeth that come out first. And it's very variable. Your first child might have it at 4 months, your second child at 1 year, 8 months. 1 year, 6 months. Please do not be worried. Each child is very different. And even if they're identical twins, they might still behave very differently. So each child is taken at their own speed, as long as they're maintaining that growth pattern for the weight, they're maintaining the growth pattern for the height, and they're achieving each of their milestones independently. Mind you, I'm talking about a child who's born normally, not a preterm child, and not a child who has any developmental delay. That we'll discuss that in a separate session and go through children who are born preterm and probably go through children who now have other developmental delays. Right? The other thing we'll actually look at is now from 9 months onwards, we'll go through that step by step from the next. In a few minutes, we'll actually go through that again. We'll just take a short break and we'll be back and continue with this session and complete it. Welcome back from the short break. This is just a continuation to remind you that we are going back following the child growth and what specific things to look out for as your child grows through the different stages of life. I'd left it at 9 months of age, what to look out for in your child. Now I'll proceed to the 1 year checkup when you come to get your child checked. At 1 year of age, there are certain things that you must keep in mind. Your child now almost all of them have started to walk, at least with holding things and supporting themselves, and they'll start walking from place to place. So they'll hold a chair, follow the chair till the end, then hold a table, continue walking. Some of them might just start walking on their own. So some of the things they might do when they walk, we get a lot of questions on why does my child walk with the legs wide apart and the legs look like they're bowing inwards? Is that normal for my child to have that? Or I've been told my child has a deficiency of vitamin D, of calcium, the bones are weak. Is that why my child walks like that? Most children, when they start to walk, they always walk with their feet slightly wide apart, so they'll almost always walk that way and keep their legs that way. The reason being, they're still learning how to balance. And the best way to balance for all of us when we have trouble is to keep our feet wide. The moment we keep our feet wide, we are now more stable and we can balance. So the child is just learning step by step how to walk. The legs are not yet strong, the bones are not yet strong, and always they will always be a little bit bent inwards, like they're bowing inwards. That's normal for your child. It might be normal until the age of about 2.5, 3 years. Please do not be worried unless you think it's abnormally bowing inwards and it's literally like a round circle. Yes, bring your child, you get your child looked at. But it's a normal process for the child to actually walk in that position. At 1 year of age, now they're experimenting with a lot of things. So they will hold things in their hands. They will want to scribble with things they catch. If you give them a spoon, they will take the spoon, put it in the mouth, put it back down. And for them, the joy is not only in putting the spoon in the mouth, but if you put, say for example, porridge on the table, they will want to take the porridge and splash it all over the table, just because the sound of the splashing and seeing things spray around them is things that they enjoy. So they will make a mess. Do not be worried if they make a mess. That's part of them growing up, and they will want to make a mess because now they learn from making that mess, and they will do that. Again, at about 1 year now is around the same time, between 1 and 1.5 years, they start to pronounce words. So they will start saying mama, baba. So words that only have what you'd call the 2 syllables, ma, ba. They will start doing that. So each of those words they will start to pronounce, and they'll become quite clear and very specific. So if they say mama, they're looking for the mother. They say baba or dada, they're looking for the father. They become very specific with what they want. About the same time, there's some vaccinations which are not compulsory if you're following the government program of vaccinations, which are given at 1 year. That the private vaccinations, or the ones that are voluntary, which are usually given at 1 year of age, your child would probably receive those vaccines at 1 year of age. If we move further towards 1.5 years of age now, this is about the time when your child is looking for complete independence. They want to be left alone. They no longer want to be carried as much. They have found their feet and they want to move. They will run. They will try and climb. They will try and explore everything around them. Now they start fearing strangers a lot more. So if a stranger lifts them, they will not accept. They want to be held only by the people they know. They will cry. They will fight. They will do all those things at about 1.5 years of age. As far as weight gain goes for your child, there's a rough way you can actually tell that your child is gaining weight. From the birth weight to about 6 months, they become roughly twice their weight. From 6 months to 1 year of age, they become roughly 3 times the weight they were born with. So if your child was born at 3 kilograms, at 6 months we expect them to be about 6 kilograms. At about 1 year, we expect them to roughly be around 9 kilograms. 9 kilograms. We expect them to be in that range. Between 1.5 year, if you look at that book and the growth charts that we've plotted in that book of yours, you'll notice that the growth curve tends to become a little bit more flat and does not go as fast as it was below 1.5 years of age. That's expected because this is about the same time the child is eating everything and you're introducing very many things in the diet. So it's about the same time you don't know how much energy your child needs, how much protein your child needs, and there might be a little slowdown in weight gain just because you're trying to understand what your child wants, and now your child has learned to move around. So they're burning a lot of energy, they're running, they're playing, they're doing everything. So from about 1.5 years to around now 2 and 3 years of age, most of the growth now is less focused on the physical growth. We now focus more on the mental growth of your child. So we try and see what is your child capable of doing in terms of mentally. So can your child start to hold things like pens and want to write? Does your child want to scribble and draw things? Does your child start to talk to people and try and put in sentences? So they might say, Mama, come. Baba, come. They're trying to put things together. And by around 3 years, they understand everything that you tell them. You tell them stop, they will stop. You tell them come and do this, they will pick up pencil or mug and try and come and give it to you. So they're growing both mentally, intellectually. They're actually growing quite fast. They also get more of a sense of independence after 3 years. and generally will not want a lot of adult company after 3 years. They want more children. They want to play with more children. So if you live in a neighborhood where the children available to play, allow your child to play with other children, simply because that interaction with other children develops the skills further, especially the way they speak. We think that children learn from us as adults, but interestingly enough, they learn better from other children. So let your child play with other children for growth of speech, for growth of how they interact. Again, they learn to become more independent, that this is what I should do when I play with other children. This is how I should behave. And they learn a lot of things at that point in time from other children. As we get older to about 5 years, most children are in school at that point in time. And now the teachers monitor how well a child can add basic numbers. Can they add 3 plus 3? How can they do it? Can they also do things like, if they're told, pick this pencil, draw or write this, they start to learn the alphabet, they start to learn how to write everything. And they're now almost independent from you by the time they're getting to 5 years and above, and want to spend as little time as possible staying with adults. They would rather have their own company as children. If you have older siblings in the house, preferably allow them to interact with the younger ones, and they're more likely to learn things faster. If you notice your child is a bit slow when it comes to speech, usually these are children who don't get to interact with other children quite often, so they don't pick up speech as quickly. And the ones who have older siblings in the house generally speak much faster and have a much larger command of vocabulary, just because they've heard an older child speak. So they might put together 3 to 4 word sentences by the time they're like 3.5, 4 years, because they've heard an older sibling speak. So it's to your advantage sometimes to have children around, even if it's your nephews, your nieces, playing with your children, or even children in the neighborhood. But caution at that point is, children do not know how to judge, is this good behavior, is this bad behavior? So they might get destructive, they might throw things, break things, because they've seen other children do it. A lot of the times we resort to shouting at them, we resort to punishing them, so spanking them, which has both its advantages and its disadvantages. So when that child is growing, once in a while, if you spank your child, generally the rule is, do not spank them out of just anger. If you sit down with a child who's about 3 to 5 years of age, you could get them to understand what it is that they've done wrong, and you may not necessarily have to spank them. But there are times when a child consistently does the same thing and it's always destructive. 2 things could happen. Either the child is learning the wrong habits from fellow children, or has watched an older sibling do that, or when the first time they did it, there was no corrective response by the parent that, no, this is wrong, do not do it. So in that sense, the child learned that this is not wrong behavior, and they continue doing it simply because they don't understand that this is the wrong behavior. As we get older and we reach now about the 10-year age period, this is around the point where your child does not want to be with you. They're much happier in school. They're much happier going out with the school, playing in school with their friends. They don't want to come home in a hurry when school ends. They'd rather play football, rather go and play in the grass, do all sorts of things with the children in school. And they're now almost forming their own identity, because they're heading towards adolescence, puberty, from the age of around, probably earlier for girls, maybe from about 10 years onwards, and boys would reach about 12 to 13 years onwards. This is about the time where you have to be very careful with your children. It's easy to let them out of the house and play with other children, but they're also very possible to influence, and they learn the wrong behavior at that age. So this is about the point where you have to watch, how is my child, whom is my child interacting with? How can I get them to interact better? How do I monitor what my child watches on TV? How my child interacts with other children, what my child is learning. Now you have to be very, very cautious as a parent. They can easily learn the wrong things. It's about the time when you must watch what's happening. So just if I was to summarize what we've been doing throughout at this point, just following a child's growth, both physically and mentally, from the time they were born as a normal child until about the time when they reach 10 years of age. I would like to keep it between that period for now, simply because adolescence and growth after that till about 18 years is a topic that has a lot of other things to discuss, both mentally, socially, physically, which I'd like to separate between the two children. So this is the first part of the series, and I'd like to end here. Assalamu alaikum.